It's on the news. It's in the magazines. Entire documentaries are dedicated to it. If the words access to healthcare are brought up in a conversation in the U.S., Obamacare may be the first related topic to come to mind. When considering a global perspective, Haiti may be a country people may associate with the topic because of its poor access to healthcare. But what is it, really? Such a broad topic's definition would surely be comprised of multiple sub-definitions, dependent upon the scale, the resources, and the variables. What is considered good or bad access to healthcare? In America, our current healthcare system has both positive and negative connotations, but when compared to the lack of a healthcare system in a developing country, it's pretty darn good. But, since healthcare is still constantly in the news, it is obviously still a concern and has room for improvement, even in countries that do have its healthcare system implemented. So, what are people doing about the problem in foreign countries? Private organizations are a central source of healthcare for underdeveloped countries in need. Doctors Without Borders, a humanitarian aid, non-governmental organization, is known for its efforts in war-torn regions and developing countries facing endemic diseases. The company Novartis provides access to healthcare throughout the world through non-for-profit and philanthropic programs. Novartis focuses on diseases such as malaria, leprosy, tuberculosis, and non-communicable diseases. The company creates new business approaches to reach underserved patients and finds new treatments and adaptive solutions to improve global health. To help provide medicines to patients with cancer in developing countries, Novartis established the Gleevec International Patient Assistance Program, which helps patients undergo treatment for two rare cancers. Through social ventures like these, Novartis has created local, maintainable capabilities for healthcare on a global level. Healthcare in the U.S. is an especially complicated business, and an expensive one, but never before has it been this complex. The intricacies of our healthcare ecology have extended into nearly every other aspect of our society. Today, the cost of healthcare has skyrocketed, outpacing the ability of employers and individuals to keep up with it. On a local scale, the Owensboro Health Coalition, known as Healthy Horizons, works to implement programs and promote the health of its citizens throughout the community. According to its mission statement, Healthy Horizons works to maintain the health status of Owensboro-Davis County, thus improving the quality of life for the citizens. Healthy Horizons works to help reduce unnecessary suffering, illness, disability, and death by promoting good health practices and by developing and implementing preventative strategies to educate the citizens. Patty Martin is an executive team member of Healthy Horizons. She spoke about the Community Health Needs Assessment and how every 3 years the coalition evaluates the community to focus on the top 3 health needs. This year, the needs were determined to be obesity, substance abuse, and access to care.
This is the second time that we've done a Community Health Needs Assessment. It's a requirement with the Affordable Care Act. Technically, every community is supposed to have a community-based health board, which that's what we are. And that community board has some role in the needs assessment. It is a whole bunch of questions, and it pulls in economic data and like how many people smoke and what are their ages, how many people have cancer. All of that comes out of it in addition to questionnaires that you and I might fill out. And then all that information is compiled in one big database, and then they spit out this big report that is basically saying these are the answers to everything you want to know about our community and our health needs. Then when you get to access to care, you might have noticed in the past 2 years, I guess, the differences that Owensboro Health is making. They became a regional facility. They formed relationships with some primary care physicians that may be outside of our usual service area because there are a lot of needs in those communities that just a primary care physician may not be able to offer. Like ongoing care, if you have a heart attack, what happens from the time you go into the hospital to your follow-up, like, hey, I've got a question, having chest pains now and what's going on, and it's a whole list of things that a primary care physician by themselves
won't be able to handle.
Yes. The other access to care issue is where are our ambulances, EMTs, how long does it take for those people to get to you? Do we have those people trained?
Is that all underneath the access to care?
No, I mean, there are a lot of things. They take on the facilities management, like having a green belt, having enough facilities for people to get physical therapy or to get rehab.
As a final question, I asked Ms. Martin her views on the coalition.
We are truly a community organization. We're not nonprofit. We're not any profit. We're not for-profit. We're not non-for-profit. We're not a government organization. We are truly just a community action team. That's it. And how great, that I can sit next to somebody who is a photographer or runs a school or a nursing home, and we all work together towards the same thing.
So, on a closing note, there is still room for improvement in our international healthcare systems, but there are also people attempting to make a difference at practically every rung of the healthcare ladder, whether regional, national, or global. On whatever scale, impact is still impact.